Hi, welcome to my research presentation. I'm Bobby Mosman. Dysphagia is a neurological disorder which affects a person's ability to swallow effectively. Dysphagia can occur in any person, across the lifespan, and for varied reasons. Dysphagia in the newborn and infant population is particularly detrimental as those infants stand a greater likelihood of aspirating fluids and food into the lungs, which may result in pneumonia. Left unidentified, these aspiration pneumonias may reoccur or persist and result in pulmonary damage to the child. Also of great concern is safety. A child with dysphagia is more likely to gag and choke on fluids or foods. Other areas of main concern are that the infant will not be able to sustain adequate nutrition and hydration via oral intake alone. Still further concern is that the infant will develop a food aversion or food refusal. While behavioral in nature, this is still extraordinarily detrimental to the child. So from a health, safety, and developmental standpoint, it is crucial to identify, assess, and intervene as early as possible. Taking steps to identify and resolve the dysphagia will have a great impact on not only the quality of life of the infant, but of his or her caregivers as well. For this study, we gathered the medical records of the infant and the mother. We reviewed them for the health of the pregnancy as well as subsequent delivery. We further reviewed the infant's medical records for formal diagnoses, evaluations completed, targeted problems associated with the dysphagia, such as tongue lateralization, jaw grading, and advancing textures for age-appropriate oral intake. We also took a look at the specific goals related to each problem and the treatment recommendations recommended for each problem. We then established a timeline of patient progress so that we could see what was helping to resolve the dysphagia. In general, we found that oral motor stimulation therapies with parent-child modeling exercises. Also, we found that oral cavity and facial exercises were effective therapies in helping to resolve the dysphagia by the age of 2 years, 8 months. Causes of dysphagia in the newborn and infant population are widely varied. This case documents traumatic birth incident of the infant. So while that we were unable to show a direct link between the traumatic birth incident and the dysphagia in the infant, we conclude that further research is necessary to find what is the prevalence of newborns and infants with dysphagia post-traumatic birth. We find that further research in this area could provide beneficial implications for the advancement of medical care for similar infants, such as providing information to parents and caregivers in an educational format prior to even leaving the hospital when a traumatic birth has occurred. Also, it's a possibility to add screening items to well baby checks immediately after the baby is born, like at the very new well baby checks. We find that could be beneficial. I would love any questions. Okay, so that was a little bit rough too. I practiced it all the way down. I can pretty much get through it without any problems. That was maybe a little bit longer than I wanted it to be, but I will practice it again in the morning. I stopped in North Platte for the night because I just feel rotten. I have bad sinus infection. So there's my video. I'm going to go to bed and I will practice it again on my hour-and-a-half drive to Kearney first thing in the morning. Okay, bye.